Hi everyone, Liz, mental health and education professional.
Well, we'll be diving deep into the QbADHD test, a groundbreaking tool in the field of attention deficit hyperactivity disorder assessment.
The NHS has recently been given the green light to use a groundbreaking digital test that could dramatically speed up an ADHD diagnosis in children and young people. This is a game changer. Up until now, getting an ADHD diagnosis could take several years, leaving many families frustrated and without support.
What is the QbADHD test? The QbADHD test, known as a QbTest, is a computerized assessment tool designed to provide objective information to aid in the evaluation of ADHD. It's important to note that the test is not a standalone diagnostic tool, but rather a valuable component of a comprehensive ADHD assessment process. The test combines a continuous performance test with an objective measure of activity. It assesses three core symptoms: attention, impulsivity, and hyperactivity. What makes the QbTest unique is its ability to measure these symptoms objectively, providing standardized data that can be compared to age and gender-matched norms. How does the QbTest work? Let's break down the test procedure. Firstly, the individual being assessed sits in front of a computer screen. Then, a soft, flexible headband with a reflective ball is placed on their head to measure movement. During the test, which lasts about 15 to 20 minutes, depending on age, the individual is asked to respond to certain shapes appearing on the screen by clicking the button. The test measures attention by tracking how well the person focuses on the task, impulsivity by recording responses to incorrect stimuli, and hyperactivity using an infrared camera to track head movements. Does a QbTest diagnose ADHD? This is a crucial point to understand. The QbTest does not diagnose ADHD on its own. It's designed to be used in conjunction with other assessment tools and clinical judgment. Think of it as a piece of the diagnostic puzzle, providing objective data to support the overall assessment process. The test results offer valuable insights into an individual's behaviour patterns, which can help clinicians to make a more informed decision. A comprehensive ADHD diagnosis still requires a thorough clinical evaluation, including interviews, behavioural observations, and other standardised assessments. Now let's address a common question. How much does a QbTest cost? In the UK, the cost of a QbTest ranges from £23 to £96 per assessment, excluding VAT. This cost can vary depending on factors such as test volume, specific healthcare provider policies. It's worth noting that this is an additional cost to standard care assessments. Accuracy and validity. A key question many people have is, how accurate is the QbTest? Research has shown that the QbTest demonstrates good sensitivity in identifying ADHD symptoms. However, it's crucial to remember that it's not designed to be used in isolation. Its true value lies in how it complements other assessment methods. The test has been CE marked and FDA cleared, which speaks to its validity as a medical device. Like any assessment tool, its accuracy can be influenced by various factors, including the individual's state on the day of testing and how well the test instructions are followed. The benefits and limitations of the QbTest. Some benefits of the QbTest: objectivity. It provides standardized quantitative data, reducing reliance on subjective observations. Efficiency. Studies have shown that using QbTest can lead to faster diagnosis and fewer consultations. The test can be used to evaluate the effectiveness of ADHD treatments over time. However, it's also important to acknowledge its limitations. It's not a standalone diagnostic tool. It must be used as part of a comprehensive assessment. It may not be suitable for all individuals. Some people, particularly those with severe ADHD or other conditions, might struggle to complete the test. Just like any test, results should be interpreted cautiously and in context. The QbTest process. So what happens during and after a QbTest? During the test, a trained healthcare professional will guide the individual through the process, ensuring they understand the instructions and feel comfortable. Caregivers are typically asked to leave the room to minimise distractions. After the test, the results are analysed and interpreted by a qualified clinician. These results are then discussed as part of the broader assessment process. It's important to note that a single result does not necessarily indicate ADHD, just as another result doesn't rule it out. Results are always considered alongside other clinical information. Explaining the QbTest to children. For younger patients, explaining the QbTest can be crucial for ensuring their cooperation and reducing anxiety. Here's a simple way to explain it. We're going to play a special computer game that helps us to understand how your brain works. You'll wear a headband with a little ball on it, and you'll click a button when you see certain shapes on the screen. It's not a test you can pass or fail, we just want to see how you do. The game will help us figure out the best way to help you learn and focus better. In conclusion, the QbADHD test represents a significant advancement in ADHD assessment. While it's not a magic solution or a standalone diagnostic tool, it offers valuable objective data that can enhance the accuracy of ADHD evaluations. As with any medical procedure, if you're considering a QbTest for yourself or a loved one, it's essential to discuss it thoroughly with your healthcare provider. They can provide personalised advice based on your specific situation and help you understand how the QbTest fits into the broader picture of ADHD assessment and management. Thank you for joining me today to explore the QbADHD test. If you found the information helpful, please like and subscribe for more videos on ADHD and mental health topics. Don't forget to share your thoughts and questions in the comments below. Until next time, take care.